Hi, today we are looking at the last dash point, the Ottawa Charter in action, in reference to the last dash point on your syllabus of focus question 4, which is health promotion based on the 5 action areas of the Ottawa Charter. Now, what we're going to cover in today's session is we're going to run over the 5 principles within the Ottawa Charter and health promotion and the 5 areas and definitions, and some examples we can give for each action of the Ottawa Charter. And we're also going to look at the Learn To, which is critically analyse the importance of the 5 action areas of the Ottawa Charter through a study of 2 health promotion initiatives. Now, within this Learn To, you have a choice. You need to pick 2 health promotion initiatives, such as Close the Gap and Make Healthy Normal, for instance. And then you need to go through each action and identify ways in which that campaign has met the action of the Charter. When we look at the Ottawa Charter in reference to health promotion, we have to remember that Australia bases its health promotion around the 5 actions of the Ottawa Charter. And there are reasons that it does that and many benefits. The benefit includes, when we base health promotion around the Ottawa Charter, is better results of health promotion that addresses all the determinants of health, greater empowerment of individuals and groups, and health promotion is much more beneficial when it is based on the principles of social justice. So to start with, let's look at our 5 action areas of the Charter. Now, we should all be familiar with the 5 action areas of the Charter from our prelim content, but we're just going to go through them now and look at some examples that we can give under each action area. So developing personal skills is empowering people with the knowledge and resources so they can improve their health. An example that you can give here is any campaign and what's available on their websites, such as the Cancer Council website, giving information on slop, slap, and how people can improve their health in terms of skin cancer and what they can do to prevent this. Create supportive environments is where people live, work, and play. That's the definition. Strengthening community action is empowerment of communities to identify and implement actions to address their health concerns. Reorientating health services. Emphasis is no more on diagnosis and treatment. This includes different groups working together to achieve good health. This is a fresh approach, and it's come a long way since the emphasis just on doctors and nurses, trying to move away from that approach and look at groups working together, such as individuals, governments, and communities, to actually improve their health for the better. And our last action area is building public policy. This is laws, regulations, and direction of policies which are aimed to making a healthy choice easier. Within your notes, you've also got lots of examples where you can give specific ideas in reference to how we link campaigns, information in our communities, doctors' services into each action of the Charter. So for developing personal skills, you've got campaigns such as Go for 2 and 5 and quit smoking programs. We've got speeding and school zones, alcohol-free areas, counsellors and schools for creative supportive environments. For strengthening community action, self-help groups, health promoting schools and driver reviver stations. And for reorientating health services, we're looking at things like doctors working in childcare centres to promote immunisation, pharmacists at nursing homes to improve preventative strategies, and police working with schools to address issues such as alcohol and drink driving. For building healthy public policy, this is any laws and policies that are put in place, such as smoke-free workplaces, banning the advertising of cigarettes, and compulsory swimming pool fencing in the home and in public swimming pools. As I said at the start of this video, the main thing that we're going to look at today is how the action areas of the Charter actually link into 2 health promotion initiatives. Now, I'm going to give you an example of Close the Gap, which is a strategy an initiative that is looking at closing the gap and the life expectancy gap between Australians and Aboriginal Indigenous Australians. This initiative has been successful in some ways, and in other ways, areas have not been met. By 2030, Close the Gap is suggesting that inequities will not exist and the health and life expectancy will be zero for Aboriginal Australians. Now, what we're going to look at is how the action areas of the Charter, the 5 areas, can link in to the Close the Gap initiative and how they are meeting the aims of their health promotion through these 5 action areas. So looking at Close the Gap, which is a policy that was created in 2008, we are linking the Close the Gap initiative to each action area of the Charter. What I would like you to do after I've gone through Close the Gap is create another grid like this one, but it would be completely empty, except it would have the action areas, 5 action areas of the Charter, and you need to link it to another health promotion approach. Now, you have just done that in your assessment. So whatever you did for your assessment, if I did Make Healthy Normal, you already have the answers to this. You just need to fill out the grid and link each action area to your initiative. So I'm going to go through Close the Gap with you, and you've got notes on this. But for the second initiative, because the right-hand side is asking for 2 case studies to be looked at, you are going to do the case study that you did for your assessment if you were to get a question on 2 initiatives. Going back to Closing the Gap, you'll see within this grid that each action area of the Ottawa Charter is linking examples on how this policy meets that action area. So building healthy public policy, as we know, is laws and policies that have been put in place. The example for this is the creation of Closing the Gap. In 2008, the Close the Gap statement by the Prime Minister, it was stated that this initiative was going to try and close the life gap by 2030. It established a national Indigenous representative body, so that's looking at communities and governments working together, and it provides funding to build a skilled and professional workforce to cope with the challenges of remote Indigenous education. So building healthy public policy, the example of this initiative linking to the action area is actually putting the campaign in place. Creative supportive environments ensures that ATSIs have access to medical services, whether that be in rural and remote areas, or where Aboriginal Australians are living. It ensures that supplies of fresh, healthy foods are available to Indigenous people so they can improve their level of health, provides the necessary housing, waste supply systems to support the achievement of health inequity that exists. It also looks at creating safe communities and improving the laws and justice systems within those communities. And looking at creating job opportunities so parents have money to provide a supportive environment for their children. You can look for creative supportive environments. You can look at jobs that were created through the Purple Health House Initiative as well, in allowing the Aboriginals to have jobs and access to healthcare through such initiatives. Strengthening community action involve Aboriginal and Torres Strait Islanders peoples' representative bodies as active participants in health planning. So we know from our definition of strengthening community action, it's when people living in that community actually have a say on what goes on and what initiatives the government are implementing. So the delivery of culturally appropriate primary healthcare services by the Aboriginal community is where the community are having an impact in what is being delivered and working with governments to say this is how we think you can improve the health of our community. Developing personal skills provides healthcare and access to early learning support for Indigenous mothers, babies and children. Schooling and education, which focuses on enabling the transition pathway into schooling and into work. Mark Morrison came to deliver to our school a presentation on how his community is working to improve the health of Indigenous Australians, and that's by setting up a school and delivering education and health services to those young people to improve their health. So that is an example of developing personal skills in reference to closing the gap. And reorientating health services provides appropriate education through health services to promote healthy, structured lifestyles and prevent the onset of chronic disease, things like STIs, low birth weight. So when we talk about reorientating health services, it's about people going into the community and working with Indigenous Australians, nurses, doctors, healthcare workers, police, in how they can improve their health and programs that can be put in place to develop their health in this area. So it's moving away from a traditional approach and getting people to go into work in that community to deliver programs. Now, through the Close the Gap initiative, you can see through these examples that I've given, each action area successfully meets the Closing the Gap initiative, and you have to provide in a question for each action area of the charter. You need to be able to define the action area of the charter, and then you need to give an example in reference to the initiative we're looking at, which is Closing the Gap, a specific example for each action area on Closing the Gap, and then link it back to improving health. And for Closing the Gap, it's improving the health of the Indigenous Australians. For your other case study that you've covered within your assessment, if I'm doing Make Healthy Normal, that is reducing the likelihood of CBD. If I'm doing, things like Your Time in the Sun, I'm reducing cancer and therefore improving health. So you need to look at what the initiative is covering. And your link back would be how that initiative improves health in a certain area. So before this tutorial finishes, what I now want you to do is go away and fill in this grid for the initiative that you have done within your assessment. So then you'll have 2 case studies to be able to complete an answer on the right-hand side and the Learn To. Thank you.